So you remember we talked about uppers and downers, right? So barbiturates are one of the downers. Okay, they bring everything down, your vital signs, everything. They bring everything down. You get to know why we are seeing everything down. Okay. So how do they behave? Or how yes, how do they behave? Right. They depress the CNS. In short, that's what they do. They decrease impulse transmission to the cerebral cortex. All right. And they are used for all seizure types. And they are not first line, okay, treatment for seizures. Let me just mention this here so that we can move on. First line treatment for seizures are the benzodiazepines. Okay, benzodiazepines. Let me elaborate on that for you to understand. When someone is in active seizure and you want to abort it, you use a benzodiazepine, okay, whether midazolam or lorazepam or diazepam. That is what you can use to abort it. If you give the person phenytoin, phenytoin will take long, okay. Phenytoin is not used to abort acute seizures. It helps to prevent seizure though, but it's not a first line. So let us take note of it. And the next one, they're also saying phenobab, right? Or barbiturate, you know. Most of us are aware of phenobab, right? Or phenobarbital. Phenobab for short. That's what some people say, right? So there's also another type, Pemidine. So they are also used to prevent seizure and to solve seizure issues, but they are not first line now. But these ones are a bit quicker than the phenytoin. That's what I've seen. All right. Now, side effects. Remember, we are saying they are downers. So you know what downers are. They bring everything down. So they cause drowsiness, they cause respiratory depression, they cause paradoxical excitement. That's only in older adults. Then this one, so this one are side effects, okay. And when you see rash is not a normal side effect. Always take it serious after giving this medication, okay. So it could even be the beginning of Steven Johnson syndrome. Okay? It could be. All right. Then when you look at the right side here, we are saying nursing considerations, things that you have to consider when you are giving this drug. Okay. The first one here is monitor respiratory status because we are saying it causes respiratory depression. Okay, so you have to monitor respiratory status. Then you have to monitor liver function because most of these drugs are metabolized in the liver. Okay, so you have to um, monitor liver functions. You know, when we talk about liver functions, you remember AST and ALT. Those are the things that should come into your mind. But if you want to know the manifestations on the body or on the skin, you know, you have this jaundice. And you know that when the liver is malfunctioning, you can get petechia, or you can even get a normal rash too. You know that when you have severe liver issues, you can get a rash, things falling in your skin. And monitor CBC, okay, complete blood count. Assess mental status because it depresses the CNS. Then you have to avoid other CNS depressants. So imagine you are giving someone phenobarbital, and you're also giving IV morphine or fentanyl, what does it mean? It means you want to shut the person's consciousness very, very, very down, okay? Or you want to shut the person down. So avoid antidepressants when you're giving the drug. And the effect, so you see, the effect of barbiturates when you have patients taking it may take 2 to 3 weeks. Any question on this slide?
Really, so what about intravenous? Or is this one for the tablets, orals, or intravenous taking the 2 to 3 weeks?
Oh, um, barbiturate, what I've seen, phenobarb, what I've administered before is IV. I don't know whether we have the oral, but I have administered IVs couple of times. But this 2 to 3 weeks, you see, when you give medications IVs, IVs takes within 15 minutes, right? 5 to 15 minutes to work. We are talking about you reaching therapeutic levels of the drug for it to stay in your body for it to have its continuous effect. Okay, that's what we are talking about. Doesn't mean that the medication will not IV would should start working immediately or it should take longer time. So this one we are talking about therapeutic levels. For you to stay in your therapeutic levels, it takes 2 to 3 weeks. That's what it means. Not that the medication will start working like IVs start working within 5 to 10 minutes, right? Or maybe 5 to 15 minutes. But from 5 minutes you should see it working though. But after that you should after you've reached the half-life of the medication, it should be gone off. But for the medication to stay in the system to prevent seizures, that is what it takes these 2 to 3 weeks for it to have its maximum effect. Please do you understand? Franklin, you asked the question, do you understand? Or you still don't get
Yes,
it?
sir. I'm okay.
Okay. All right. So when I was mentioning vancomycin to before, okay. When you give vancomycin, with regards to your question, just to add up, when you give vancomycin, just one dose, it's like any other medication. When you give them one dose, you don't expect the medication to solve all your issues, right? You have to reach therapeutic levels. You see, like the phenytoin to that we were mentioning. When you give it one dose, you don't expect it to work throughout um, throughout your, throughout the session. Okay, whilst you have the patient, you have to keep on giving the medication until you reach a certain level. Okay, before the medication will be having a full control over whatever thing that is happening. So that's what it means. All right. If no question on that one, we have another one here to talk about. Because anti-epileptics are very dicey ones. I I have some exercise that after maybe this one we'll look at. Okay. For this one, I have a lot of questions on them. Some will bring up new ideas, and some will open our eyes to some things. Okay. So just bear in mind, I'm just telling you ahead of time. We have this succinimides. Okay. Most of the times they will quote this medication. It was succinimide. All right. This one, so this one too is a downer. Okay, like yeah, it's also like a downer. The main thing it does is for solving issues of absence seizure. So when you see questions and um, you see maybe which of these medications are used in treating absence seizure, you see this one and you see maybe phenobarbital, you see phenytoin. So you see all the anti-epileptics there. When I was doing my research, I saw a question like that, but I decided not to bring it. The questions I have here are plenty already. So I made up my mind just to tell you so that you can take notes. Okay, where you have phenobarbital, any other anti-epileptics, and they ask you which one is used for treating absence seizure or petit mal seizure, please. It is this ethoxyzimide, okay? Ethoxyzimide. So that is the main purpose of this drug. And the side effects that you can have is drowsiness, nausea and vomiting, pink urine. Some people may react to it. So when you see anything like rash, just don't ignore it. Okay, it could be Steven Johnson syndrome. Then this one also causes bone marrow depression. That is when they reach their toxic levels. So because they cause bone marrow depression, what do you have to do when you are nursing people on this medication? You have to monitor CBC levels. So there is something that runs through all of these medications. You know, look at them well. For most of them, liver, CBC, you have to monitor. Okay, then you have to monitor for rash, and they are likely to be downers. Okay, they are mostly downers. Okay, it's like it runs through all of them. So just for you not to have lots of things going on in your mind, they run through all of them. But for this one, you have, because it has effect on the eye, you have to um, do periodic eye exams. Okay, go for periodic checks for your eyes. Then monitor for rash, so that if you are reacting to the drug, something can be done. All right. All right. Any question on this one? Any question on this one? This one was very quick, right? Now, to our next one, benzodiazepines. These ones are very common. Benzodiazepines. When you hear of diazepam, lorazepam, clonazepam, so those zepams, right? They are all what? Benzodiazepines. So, what do they do? They enhance GABA what? They enhance GABA. GABA is inhibitory neurotransmitter. When we say neurotransmitter, I hope you are aware of it, right? You know neurotransmitters. They are found within the brain, right? We have different types of them, even norepinephrine and all of that. They are even neurotransmitters. Full meaning of GABA is gamma aminobutyric acid, right? And it is like we are saying here that it is inhibitory neurotransmitter. So it's like it already depresses your uh, CNS. Let's say that this is a normal neurotransmitter within your brain. So the function of this one in its normal state is that it brings you down. Okay, it's like a downer in your brain. GABA is like a downer in your brain. So when you give benzodiazepines, it potentiates the effect of this neurotransmitter already in your brain, the GABA, okay, which is gamma aminobutyric acid. It potentiates or enhances this neurotransmitter. You know, this one is already inhibiting you, like it's bringing you down, like a downer. It's reducing your excitability. So it will cause you to calm down more. So that's how benzodiazepines work, right? And let's look at how we use them or in conditions that we use them. In status epilepticus. So these ones, they are like first line. When someone is having seizures and we give any of this medication, within short time, the seizures should be aborted. All right. So they are used in status epilepticus, and they are also used as an adjunct in seizure therapy. Okay. So we can have one main big anti-seizure. Let's say valproic acid can be going, but you'll be giving these ones as breakthrough. So we are using them as adjuncts. Okay. Can use them as adjuncts. Then also for delirium tremens. Okay. For delirium tremens. What is the delirium tremens? When you hear delirium tremens, what
After
comes into your mind? The
alcohol
condition.
withdrawal.
Good. Alcohol withdrawal. Okay. They normally have this severe agitation. Okay, when you withdraw from alcohol is a downer. When you withdraw, you exhibit signs of what happens, right? You remember when we treated those things. So when you withdraw from alcohol, you're going to have serious or let's say intense agitation. You have these tremors going on, hallucinations and those things. So benzodiazepines can help bring you down, okay, can calm you down. So that is why it's also being used here. Side effects of benzodiazepines. What does it do? It causes sedation. Of course, it's a downer. So we should expect sedation. And since it's bringing you down, it also has some effect on your vital signs like blood pressures and heart rates. Okay. So it's likely to also cause what orthostatic hypotension. Respiratory depression, you can't stick this out. Okay. And it can cause dependence. Okay. Many people would want to depend on it. Okay. It has the tendency of causing dependence. So that is one thing about these drugs. So they are also like uh those FDA like high classified drugs in the US. Yeah, they are very dangerous drugs. Okay. That they don't play with it. That's what I want to say. All right, benzodiazepines nursing consideration. When you are giving them, monitor blood pressure and pulse. When you have someone, especially an older adult, with blood pressure of let's say 90/50 or 90/50 something, when you give benzodiazepine, you are likely to shut the person off. So be careful. Even 160 sometimes, especially for older adults, doesn't mean if you are just a normal adult, you can't also have your blood pressure going down. But because it has this CNS depression effect, every bit of your vital signs can go down. That's what we are trying to say. And if you have heart rate of let's say 60 or 50 something, it will go down further. Okay. So you monitor all of these things, respiratory status, you monitor liver and kidney function. So you see, respiratory status, liver, kidney function, they are running through all of them. You know that. And they are also more of a downer. So you have to assess mental status of the patient. Then avoid alcohol and other CNS depressants. So this one to run through them. Avoid other CNS depressants. Okay, because you can't shut a person down twice, like around the same time with two different medications. So that's what we are saying here. Anything about benzodiazepines here that you don't understand?
Yes, sir.
Okay, let us hear you.
So you said I thought benzodiazepines are downers, so their side effect has to be going up.
No, downers. You are saying
Yes.
downest and you are saying up. Like downest is
Yeah, I
down. Like
mean,
just
like I thought you said when they are downers, their side effects are uppers.
no, they are
Mm-mm.
withdrawal. When you
Oh,
withdraw,
okay, withdrawal. Oh,
yeah.
okay,
So
okay.
when
Oh,
you withdraw, everything will go up.
yeah,
Okay.
okay.
But the
Oh,
side effect or the toxicity is like you have more of the drug in you, so it will bring you more down. Okay.
thank you.
But when you are withdrawing, it's like you are going the opposite way. Okay. So everything will be in opposite. Any other question? Okay. Now to talk about the
Hello,
next thing.
sir.
Yes.
And please, as part of the nursing consideration, are you can you also monitor the patient's SpO2 when you
Oh
administer the
yes.
diazepam? Because
Yes.
most of
So
the
if
time the oxygen saturation levels also fall.
yes. Yes. So one way or the other, it's like it's included in the second point here, respiratory
Okay,
status. Yes, so both respiratory rate, the depth of the respiratory of the respiration. Okay, so how
okay,
deep or slow the person is breathing, then the count, and how it's being reflected on the SpO2, like pulses. Okay, so they are all in one bracket here. So it is true. Okay, it's true. All right. Any other question?
Hello, sir.
Yes, sister.
Please, does it mean the toxicity is the same as the side effects?
So they are in the same way, or in the same direction. We spoke about that during our first time meeting on this topic. Okay, so
Okay.
it's the same way. When you hear of toxicity, you hear of intoxication, or you hear of there's another word. Who remembers that word? Have you forgotten? So toxicity, intoxication,
Is this
uh,
sedation?
no, like like overdose. Yeah, overdose is what I wanted to say. Overdose. You know, all of these things, all of these words means that you have more of the drug in you. Do you agree? When you have intoxication, it means you have more of the drug in you. That's why you are intoxicated.
Yes.
Okay. When you have overdose, overdose is even a simple word, which means you have more of the drug in you. And if you have intoxication too, or toxicity, it means it's more in you in a way that it has become toxic. So they are all similar words that we use in the same direction. So when you have any downer like this, being intoxication or overdose or toxicity, everything comes down. Okay, so it is the withdrawal part which is opposite. So when you have withdrawal of this, instead of you coming down, everything will go up. Do you get it?
Yes, please.
All right. Yes, any other question on this?
Well, yeah, please, is this the only slide for the benzodiazepines or there is more to it?
For now, I think that is all. That is a rundown of the whole thing.
You want
Okay,
more?
there. No,
Well, there are a
I
lot of
didn't.
things, but I try to make it more simple and concise.
I didn't see the antidote when the overdose comes in.
Oh, okay. So, nice one. So, what is the antidote for barbiturates? Sorry, for benzodiazepines. Good. Thanks for bringing that up.
No. The
Flumazenol.
Mazino, let me see.
Flumazenol.
Oh, I didn't capture it here. Yes, it's true. I should have captured it.
Your
Yeah.
students are good, oh.
Yes, they are good. I should have captured this. Previously, we were talking about antidotes for the rest of them, right? But not all. You should know that not all medications have antidotes. Yeah. We
Yeah.
spoke about
Aspirin.
acetaminophen, yeah,
Aspirin.
aspirin and all of that. Yeah.
Aspirin.
So this one is very important. Imaginal, please let me write it here. I think. It was part of those I had to capture. So when you give Roma, is it I or yeah, ZE? It's E rather. Yeah, flumazenil. I'm sure. Yeah, it's this flumazenil. I hope this is the right spelling, right? Yeah, I'm sure.
Yeah.
Flumazenil. So please take note of this drug. That is the antidote. So when you give more of, let's say, diazepam, and patient is going down, way down, okay, or when you give more of lorazepam, any of the benzodiazepine, when the patient is going down, this is the antidote. Okay. I hope you've seen this drug before. Most of us here too, we have given some before. They are very common. They should be in every ICU. Okay, or any emergency. Okay, emergency unit ICU, they should have these drugs. All right. So that is it. So when I give, let's say, when someone has taken cocaine, let me see if I can throw you off a bit. When someone has taken cocaine and the person is showing severe form of overdose, what can I use to reverse it?
Please, I didn't hear.
When someone has taken cocaine, okay, and the person is showing very serious signs of overdose, what drug can I use to reverse it?
Naloxone.
Okay.
Are you sure?
This one, you do conservative treatment.
Okay. Okay. Are you sure?
Because this one has no antidote directly.
Please,
That's no direct.
the question
Okay.
again.
Some
Please,
people are
can we
thinking
use,
harder. So I'm saying when someone comes to the hospital and the person has cocaine,
Hello.
please, can we use the flumazenil?
when you use the
Oh, yeah.
flumazenil, yes,
Because I'm seeing that. Hello, I'm seeing that the flumaz. Okay,
you,
I was trying.
you
I
you
was
want to
trying.
withdraw,
I was
right?
trying.
You want to withdraw your statement. So let's think.
Yeah, I was
Let's think.
trying.
Yeah, I've seen what you mean. Let's say
Okay,
when someone is taking cocaine and the cocaine, let's say the person has overdose of cocaine, what do you think will be happening to the patient? Cocaine is an upper, right?
Yes, it's an upper.
So how will you
Hypertensive
treat this?
crisis.
Can we
So how will
give
you
the
treat that case?
benzos?
Yes, you can give benzodiazepine, like you can give downers to calm the patient down. It is not a direct, it is not a direct antidote, right? But it can help bring the person down. Do you understand the concept?
Yes.
I have a follow-up question to ask you, but I want you to understand this before. Someone who has overdosed cocaine, you know, cocaine is an upper, right? So the person will be agitated, will be all over, right? So you have to bring the person down. So benzodiazepines can help calm the person down, right? Blood pressures, even when blood pressures are high, the person is tachycardic and respiratory rate, everything is high. Benzodiazepam can bring everything down perfectly to its normal status. Okay. Now, what of if you have another situation whereby a patient is coming to the hospital, okay? The person has taken an unknown drug. So the question is an unknown drug, you don't know. But this person's respiratory rate is down, blood pressures and everything is down. What do you think you can give the person to help? If there's a confirmation that the person has taken an unknown drug and the person is down,
Naloxone.
good. So in this case, you suspect opioid overdose. then you can give naloxone. Do you get the trend?
So do you have to assess
Yeah.
for the signs that the patient is showing before you give the naloxone, or you just give the naloxone because you
Yeah.
think it's opioid?
Yeah, so I've given you the assessment already in my question.
Okay.
Okay. So in my question, I said the person came to the hospital with a confirmed intake of unknown drug. Respiratory rate is down. Okay. Blood pressures and all of those things is down. So that is my assessment, the question for you. So one, there is a confirmed, please listen to this. So there's a confirmed, I've met real case scenario on this one before, and we used naloxone, everything was fine. Okay. If someone confirms that the person took a drug which is unknown, that's one case. And after the person took that drug, everything is down. Take it as a downer. Okay. Treat the person as a downer and reverse whichever drug. And for downers, generally, most of the time it's likely to be opioids, especially when it comes to drugs. They are likely to be opioids. When you use naloxone, people come back. All right, so that's one tricky question. It just came in mind. Antidote for benzodiazepines, flumazenil. This one, everyone doing NCLEX knows this drug. So if you are here, it's by force, you should know. Flumazenil, naloxone, these drugs, it's like when you are even asleep, deeply asleep, and someone wakes you up and asks you, what can I use to reverse lorazepam? Don't say, just say it right away, okay?
Okay.
All right, let's carry on. Let me clean my board. Okay, so our next one is dicarbazepines, okay? Dicarbazepines. This one too, they are not going to give you this class. They will mention this drug to you, okay, carbamazepine. That's the commonest drug they normally test on. If you don't get carbamazepine and you get oxcarbazepine, it's within the same class. So this carbazepine should tell you that at least we are talking about something closer to carbamazepine. So you should be able to tell. Okay. So carbamazepine is also used to treat tonic-clonic seizures. Okay, and complex partial seizures. All right. This one, the effect takes very, very like the therapeutic effect, when it starts taking effect, it takes you very long way. That is what I've realized with these drugs, right? And they can cause severe sedation, severe one. The benzodiazepines, they are normally short acting. Okay. They are normally short acting compared to this ones. So it's used to treat tonic-clonic seizures and complex partial seizures. Side effect is drowsiness. So this is also a downer. Drowsiness, nausea, blood dyscrasias. Who knows blood dyscrasias? Who can tell?
Low blood, low white blood cells, red blood cells,
Good,
platelets.
good, good. Or maybe disorders, they can cause disorders in all the three types of blood cells, right? Disorders. So either low or like a disorder. When you say a disorder is different from like just the normal levels going down. You know that. Okay, so that's what it means, right? The long-term use sometimes can even cause leukemia. Okay, it's also a disorder of these blood cells. And another thing is Steven-Johnson syndrome, right? So you can see this is not a normal side effect. So you can even group this one under adverse effects. Any side effect that is capable of causing lots of harm becomes an adverse effect. You don't actually want to see this happening. When you have drowsiness happening, you know it's normal with diazepines, you will have to monitor. When you see someone having Steven-Johnson syndrome, you have to solve the issue. You don't have to monitor. Just like you have to do something. That's what I want to mean. Okay. Then you can also have urine turning to pink or brown. So this one too has this here. You see, for this one too, you have to monitor what? CBC level, liver and kidney function, so rash, fever, bruise. So you see, this one runs through them too. All right, it runs through them. Okay. Any question on this?
Please, I want some clarification here.
Mm-hmm.
With the dicarbamazepine, is it a second generation of benzodiazepine? Because I can see the pines running through them. Is it a second generation of a major class of benzodiazepine?
Sorry, I was muted. Yeah,
Okay,
so
my question.
yeah, I got your question. Sorry, I was muted. So I can't. I don't think so. Well, I'm not sure. I'm not sure about that. I'm not sure about that. I know benzodiazepines is in one class, and um, di dicarbazepines are also one class. From here, let me show you. Let me show you from here. You see this one? Anti-epileptics from the main classes. You see, benzodiazepines, they are one class here, and dicarbazepines, they are one class here. Pharmacology is very broad. I don't know if you've seen it somewhere that they are under it. You can share with us. But I know them to be within different classes.
Even with the benzos, they ends with the PAM and the LAM.
Good.
So
Good.
it's different from this one.
Good. Good. So they are different. Okay. And we have the last one we'll talk about is miscellaneous. So let's say they are different because of the classes we have here. Yeah.
That's fine.
All right. Thank you. But if
Please,
anyone sees anything different, the person can share with us. Yes, Franklin.
on the issue of the blood dyscrasias, mostly what I've seen in some literatures and some questions that they will say agranulocytosis.
Okay. Okay.
Yes, for the blood dyscrasias.
Okay.
So maybe if they didn't bring maybe a red blood cell, those ones, when you can see agranulocytosis. It's referring
Okay.
to the yes.
Blood dyscrasias, right? Okay. So I don't know about everybody, but when we say granulocyte, if you can get it easy, unless you understand granulocyte. Granulocyte, they are like types of white blood cells. You know that. So when you hear of a granulocyte, most of the time when you have a beginning, when you have things beginning with A, then you have something. It means you have the suppression of it. Am I lying?
You are not lying.
Yeah, so when you have a granulocyte, granulocytes are there are different types of white blood cells, being neutrophils, basophils, the eosinophils. Like, for me, I call them NEPs, okay? NEP. N for neutrophils, E for eosinophils, then B for basophils. Like, those ones. Each one has their own function, though. So when you hear of granulocytes, it's like granulocytosis, formation of them. Granulocytosis, like anything that destroys them or prevents their multiplication or something. right? So you can think of it in that way to make it a bit easier for you. So frankly, yes, it's true. Okay. Any more question on this one, this side? Pharmacology is very broad. Should you read on this one, you see lots of big connections and a whole lot, but I've tried to make it more simple for us to get what we need, okay, for our enclaves.
Hello,
Very
hello,
broad.
sir.
Yes, sister.
Hello, sir. Please, do you have IV form of carbamazepine?
Unless we search, I haven't seen some before.
Oh, okay.
Yes, I haven't seen some before. Anyone, maybe
Okay.
we can search and see. Yes.
Okay. I'll try that, sir.
Okay.
Thank you.
All right. Any other question? All right. I think we can carry on now. All right. Someone just said yes. We have it. We have the IV form. Okay. And in the US, it has a brand name called Can Canexe. Okay.
Sir, please
Yeah. So
come again. Canese.
Canexe. You know Canexe or Canexe? Do you know that drug?
No, please.
So that's a trade name. Okay. But the generic name still stands the same.
It's
So we have
carbamazepine.
IV form of carbamazepine. Yes, I know it's not be
Oh,
common
okay.
in lots of places. Yeah, but yes, there is an IV form.
Okay. Wow. Thank you, sir.
Okay, yeah. All right. So whilst we were doing the anti-epileptics, I'm sure lots of other drugs were going on in the minds of people, but they were never mentioned, right? You see these drugs here. So we have other drugs that are used as anti-epileptics too. So these are the miscellaneous ones. First one, gabapentin. You know, gabapentin has a lot of functions. You know that. What is the common function that you know that we use gabapentin for?
For pain.
Describe the kind of pain.
Neuropathic pain.
Neuropathic.
Neuropathic pain.
Yeah.
Okay. Yes, for neuropathic pain. It's very important. Just remember the neuropathic pain aspect. So it has a very important role to play when it comes to nerve actions. You know, when we say neuropathic, it means pain associated with nerves. Okay, neuropathy. So it means it has a tendency to calm nerves. So that's how it behaves to bring down nerve pain or neuropathic pain. Okay. So because it has the tendency of calming down nerves, you know, when you have seizures, you have nerves also what set into set into motion, okay, like it's being stimulated. Okay. So gabapentin too has the effect of what? Of calming down nerves in one way or the other to prevent what seizures. So that is one miscellaneous part of it. So you can use gabapentin for neuropathic pain and also to help with seizures. Okay. We have the lamotrigine. It's also part of it. We have the levetiracetam. This is also one common part or one common drug. What is another name for this one?
Kepra.
It's
Yeah.
Keppra. Okay, Keppra. Okay, so when you have Keppra, I know people like mention the Keppra and they leave the levetiracetam because they might bite their tongue. Levetiracetam. Okay, the same as Keppra. Then valproic acid too is another anti-seizure medication, okay? Then topiramate, okay, it's also another anti-seizure. So these are other anti-seizure medications that are miscellaneous that you might see elsewhere. So just take note of them too. They are also used to prevent seizures. Okay.
Bonjour, please, with the lamotrigine, is it also for the nerve? Or is just the gabapentin? No?
For
It's an
gabapentin,
epileptic. It's mainly epileptic.
Please, can you elaborate more on that one for me?
okay, so I think for this one, you see, they play with neurotransmitters. Okay, the topiramate. Sorry, you asked about the lamotrigine, right? I
Yeah,
think it
somebody
has.
had it yesterday, so I just want to.
Oh wow! So it has yeah. So they all play on the nerves. Okay.
Okay.
Using neurotransmitters. Okay. Using neurotransmitters. I think this one plays with glutamate. Glutamate also increases excitability, right? Glutamate is a type of neurotransmitter, please, just to let you know. Okay. And
Okay.
so it all has something to do with the nerves, okay? So glutamate will increase your excitability. So lamotrigine will target glutamate and reduce the effect of glutamate. And in that way or manner, you will calm down, okay? And that will prevent the excitability of the nerve and hence help with the seizure, like help calm down the seizure. Do you get it?
Okay.
Yes. So I don't want us to, every one of them will have a different mechanism of action, right? And a different neurotransmitter to play with. But I would advise, like I would let you take one thing that's run through, or at least they play with, even if not the same, different kinds of neurotransmitters, but they help calm down the nerves. Okay.
Okay.
Yeah, either by blocking one or major neurotransmitters that helps to excite you, they bring it down. Okay. So you remember the previous one, where the one that involves GABA. GABA itself is bringing you down. The benzodiazepines, right? GABA itself is bringing you down. Then the benzodiazepine will enhance that GABA to bring you down further, right? But this one, you have glutamate, which is also a naturally existing neurotransmitter. It is bringing you up. Okay, it's exciting you, but this lamotrigine will reduce the effect of what the glutamate, and hence bring you down. Okay, so at the end of the day, you will have excited nerves coming down. That will be your end result.
Okay. So Bonjour, with the miscellaneous, does it mean that it's used for long term or?
Long term, it will
Or
depend.
is used in
I
acute
think,
cases?
I think, yeah. So these ones are major, depending on the effect that maybe the physician wants to achieve. I've seen someone on these two medications, like levetiracetam and valproic acid, for some time. It's not short term like the benzodiazepines. Benzodiazepines are short terms. These ones can be used for long term. They can take it for some time.
Okay.
Yes.
Thank you.
Who has seen someone on any benzodiazepine for about 2 weeks before, or maybe more than that, like continuously? Normally, it's not done.
IV or
Whether
other.
yes, I mean whether IV or like one.
Maximum I've seen is 5 days.
Yes, normally they don't take it for long, but for
Mm.
this one they can take it for some time.
So as regular medications or as PRN?
So the person, someone was asking like long-term intake of the medications.
Because
So
I have a
long-term, like
patient
as regular.
who has been on it for a month plus now.
Which drug?
Lorazepam, actually.
Okay, anything is possible. It depends on what the person is using to
Yeah.
treat. Yeah, anything is possible. But likely, these ones are likely to go more, not on a short term. Because even on the ward, anyone who has seen anyone with a seizure disorder before, they might be taking one of these ones for very long time.
Yeah.
Very, very long time. Okay. They might be. You remember the benzodiazepines? We also, yeah, so I think this one even adds up to what our sister just said. That someone she knows someone who has been taking Lorazepam for a very long time. Look at this one. Look at this one. Where I'm shaking my mouse. Can you see this one?
Yeah.
Yeah. Adjunct
Seizure
seizure
therapy.
therapy. Yeah.
Good. So if maybe the seizures are worse and the other anti-epileptics can't do it alone, they can add any of these ones to it as an adjunct seizure therapy. So I think it's possible that way. Okay. Yeah. Any other question?
The
Sir,
question.
Yeah. Who we have two people talking. Who is first? And raise up your hand.
Do I do
um,
that?
Okay. Zoom user. Your hand is up. Who is Zoom user?
Esther.
Esther, Zoom user. Let's go.
Sir, please, I want to find out whether pregabalin
Uh-huh.
it's another name for the gabapentin. Gabapentin.
No, they are different.
There are two different drugs in.
Drugs, yes, they are two different drugs.
Oh, okay. All right.
What's the name of the drug again?
Pregabalin.
Pregabalin. Pregabalin.
Okay. Did I bring it here?
Yeah.
I was thinking it's the same as the
No, it's not the same thing. It's a
gabapentin
different.
because
No,
of
they
No.
are
the
two
It's
different
also for
drugs.
of
nerves.
how
It's for nerve
okay,
pain,
yeah.
all right, but it's a
Because of
different.
how this one works, I was thinking it's the same medication.
I think it works also like how gabapentin
Like the
works, but they are
gabapentin
different
works.
medication. Yeah.
Mm.
Yeah.
I
Fair
didn't capture
question.
I didn't capture it here, right? I'm looking for it here.
Mm.
I didn't capture it. No.
Yeah, because like that one too is for pain,
Yes, yes.
nerve pain.
Yeah, yeah,
Neuropathic pain, yeah.
yeah. And please, so we can add it up to this one. It's part of the miscellaneous, okay?
Okay.
Please, let me see if I can write it. Yes. So it also acts like how the gabapentin also works, okay? Also for
Okay,
partial
sir.
seizures too, okay, and for neuropathic pain. Let me see if I can write it here. Yeah, the next person can ask the question as I write. Any question from anyone?
Sir.
Yes.
Okay, so when I've seen doctors prescribing sodium valproate and then levetiracetam at the same time, and then
Yeah.
the patient they do take it within the same time intervals and everything. Does it not have any effects? Like, is it not going to cause any major effects since the same drug is the two drugs are to achieve the same purpose?
Okay, so like you were saying, different drugs will have different mechanisms of action, even though they achieve the
Okay.
same aim. But seizures
Okay.
can be very stubborn.
Okay.
Okay. Do you know that every healthcare provider would want to prevent seizure? Do you know why? Whenever there is seizure, okay, there is CO2 production in the brain, and CO2 production in the brain, and is it some kind of acid? Like, in a nutshell, it doesn't help with the brain function, especially if the patient is already down. It makes the person go down like it slows down your nervous system, like your brain, and it can even make you brain dead when it happens for a very long time. Okay. And your brain your brain is you. Let me say that. Who you are, everything you are is in your brain. So that when you have a patient who is even already comatose, Normally, it's every neurologist will tell you like what neurologists hate to hear or hate to see is seizures. Because seizures will not make you it can make you sleep forever and not make you wake up. So that's why you have to. So when you're nursing any patient on anti-seizure medication, please, especially neuro patient, please be careful. And if they get seizure and you delay in abortion, some neurologists can be very mad at you. Okay, if you delay in the abortion of it. So seizure is something no one wants to happen. So if one medication is not working effectively, they can add up a lot until they achieve their effects. They are very stubborn. Okay, some seizures can get very bad seizures. Some three medications altogether can't even stop it. So yes, they can do it depending on
Okay.
what the doctor wants to achieve. Okay,
Thank you.
but normally they will start with one. They don't start with, lots of them all together. They start with one until maybe they've seen that it's not helping.
Thank you.
All right. Any other question? So we've added one drug to it. Okay, let's take note. Remember, it's also used for
Yeah.
neuropathic pain. Thank you for bringing that up. Yes.
Sir, please, about the status epilepticus tonic clonic seizure. I don't really have much idea about it. Can you please explain it to me?
Hey,
The
this one
tonic
day.
clonic. You've
Okay.
already learned it in.
Oh no. This one day, like
It's
it's
far away
like
from
a
what we
nursing
are
school
talking
something.
about.
Oh,
Yeah. Okay.
okay,
That.
okay,
But in
okay,
a brief, let me make it brief so that you understand. Um,
okay.
when we talk about tonic, okay, tonic means being. Having. We have tonic seizures alone. Like you become stiff. Clonic is the jerking. Okay, like you'll be shaking. So when you talk about tonic clonic seizure, it means you are stiff and you are shaking, jerking. Do you get it?
Oh, okay,
Tonic comes from the word tone, like your muscle tone becomes very, very, very stiff. Okay. So it's like tonic seizure.
okay.
Yeah. And well, if I should relate it to the seizure and what happens over there, that is where they have the moan cry, and all of that. Okay. When one is about to have seizure. Okay. And or when one is having seizure, let me say that. And the clonic phase is where you have the jerking. So
So,
clonic is jerking.
okay,
Okay, clonic is like you see the person shaking here and there, right? So those kinds of seizure is what we refer to the tonic clonic seizure. What was the other one?
status epilepticus.
Status epilepticus is I think that one is more chronic and more
Yeah.
dangerous one. That's when you have I think there's a category. Is it five?
Is it
Is it
when
five
the
minutes or
person
something?
seizures for a very long time?
A very long time. Good.
A continuous
Okay.
seizure.
A continuous
Continuous seizure
seizure.
episodes.
Good.
Oh,
So it's
okay.
like when you have a patient who seizes, let's say, continuously for about 5 minutes, and please, it doesn't occur only once. When you have that happening once, you can't diagnose that as status epilepticus. Like it happens multiple times. Okay. For
Okay.
that one, yes, you can have the
So,
diagnosis of epilepticus. So
And that one too is a medical emergency.
okay.
yes,
And it also lasts like for a longer period of time.
yes. Okay.
So
Seizure.
can I say that
Mhm.
please, sorry, let me ask the last question.
Oh, no
Can I
problem.
say
That's the question.
the tonic seizure, it is the unnoticed type of seizure episode. The one that like nobody observes unless you really pay attention to the patient.
I think that
In
one
some
is
of
absent seizure rather. Oh,
okay, that is absent seizure.
yeah, we
There
have
are some
absent
of them you will
seizure.
not notice that they are having the episode. That
Yeah.
is the
So
absent seizure.
yeah, so that's absent seizure. Or another word for it is the petit mort.
Oh, okay.
So they'll be there and they'll have a blank stare, like they'll be looking at a place for some time, and you shake them like they're off. Then after they'll come back. Other times between maybe 10 to 20 seconds, sometimes even up to 5 seconds, like very short time. Okay, and they'll come back.
Okay.
I think it's
Yeah.
normally common with the kids, the children.
Oh, okay. Okay. Please, are
Okay.
you answered? Any more questions?
Yes, please.
Okay, you can ask.
Sir, sir.
Yes, sister.
Yeah, sir, please. My question is, I learned like they said, if somebody is having a seizure, normally here in Ghana, we normally administer diazepam.
Uh-huh.
So, yeah, diazepam. So they are saying if you give too much of the diazepam, it collapses the heart.
Okay.
Uh-huh. And
Mhm.
I witnessed one case like that before. The woman is unconscious and started having seizure. So the doctor ordered diazepam to administer. So after we administered the diazepam, within some short possible time, the woman passes away. And they call for auditing. So when he went for the auditing, and the doctor
You
was
kill them.
saying, so the doctor
Uh-huh.
was saying like he's not supposed to order the diazepam. And at the same time, the nurse too have to check before giving the diazepam. So as long as he was like giving us the blame that if you know that this is the side effect of the, like when he ordered, you are not
Okay.
supposed to give the diazepam. But meanwhile,
I
he ordered the diazepam.
I think maybe you gave an overdose because overdose of benzodiazepines can lead to death.
Good. So I wanted to ask. Good for bringing that up. I wanted to ask.
That's
Did
really
the
true.
nurse or whoever, I mean, whether the physician, some physicians, they will just order. But the thing is, you the nurse, you see, that is why when it comes to medical legal issues, nurses are very common to fall into it than doctors.
But yeah, is
It
this
it
enclisting that is even open eyes of many of us?
Oh yes, yes, and do you know something? Someone will say that because nurses are plenty than doctors, it's not like that. Okay. Let me tell you something. Sometimes over here, sometimes you go to night, you only have to call. You'll be calling doctors. You are with the patient, things are happening. You call the doctor. Sometimes in the ICU, the patient's rooms will have computer. And wherever the doctors are, they're able to the doctor on duty, they're able to view, you have a big camera. When it gets worse, you're able to switch on the camera from wherever they are and look at patient and give you orders and everything. Fine, that is the extreme. But most of the times, you are with the patient, let's say they've ordered there's one drug. I'm also used to this because this place they are used to the trade names. Let's say Zyprexa. Zyprexa is it carbamazepine or something like? Well, let me use carbamazepine as an example. Okay, they'll give you maybe an order for carbamazepine. You are the one going to order. Okay, sorry, I'm saying you are the one going to give, and they have ordered it. You know that patient is very hypotensive. Why should you even give it in the first place? So you have to tell it is within, that's what we learn from oncology. It is within your capacity or your brain to tell the doctor that the patient maybe heart rate is this and respiratory rate is this. You can't give it. Okay. If you've called the doctor, the patient is in a very bad state. The person needs maybe something to calm him or herself. Even though patient is unstable, like agitated, okay, and blood pressures are somewhere, let's say 90. For even females, you can have very softer blood pressures, let's say 90/50. Why should you even give any benzodiazepine in the first place? So my question is, when the doctor ordered, the one who cited that example, when the doctor
Yeah.
orders, the nurse decide to find out what the blood pressure was before giving the medication? That is first one.
I don't think so. And even cry, he is our in charge and the nursing officer. And no.
So you see,
Aha.
so we commit a lot of mistakes. And these medications, so please, most of the times you don't give without a continuous cardiac monitoring. Some
And
of
I
these
don't think
medications,
he checked her vitals. I don't think
yes.
so. Because the
So
woman
even
was
if you are
just
in,
lying, she's an old woman. She was just lying there unconscious. And she
ah,
started having the seizure.
Well, how
wait,
can you administer
wait,
diazepam to an unconscious patient?
the person was also an old woman.
Yes.
Oh,
So
then
the
that is a fine
respiratory system will drop, cry.
You
You
can't
see,
do
that's
this
also a fine
in
case.
US. They will sue you.
They will sue you.
Of
And
course,
In US, they
Do you,
will sue you.
Boja, in addition for what you were talking about and what my sister said, the kind of
uh-huh.
nursing that we do in Ghana, like if not because of the NCLEX that we are learning more to equip ourselves, the moment you
Yeah.
get here, it's like you are lost.
Yes, for
So
that
the
one,
last
yes.
time, Boja, I took my child for kids well-being clinic, and somebody was going, and the RN checked the BP. And the BP was very low. I think it was 90/54. If it was in Ghana, they would say, so the BP is low. We would just concentrate on the BP, not say, oh, like it's low. But the doctor asked the RN that, what is the map?
Good. Mean arterial pressure. Very important.
And when they checked, it was like the map was normal. So the doctor said, then the BP is not the problem. So we have to
Yes.
check other things that is leading to that problem.
Good.
But if it was in Ghana, we would just concentrate on the BP.
Yeah, it's
Good.
true.
If
It's
not
true.
for NCLEX, I didn't even know the
Bring the
map
patient to
because
Good.
we do
to the
not
emergency
even
unit.
calculate for the map in Ghana.
For that one, there is true.
Some places,
Oh,
please,
some
in Ghana, some
facilities
places use
we
it. Okay.
Oh,
Yeah,
Then
in
it's the
Ghana, some
big
places use it.
hospitals. So the ones that we
Asamo.
were working in there.
Yeah.
oh no
See,
in
in
my
district
village where
hospital,
they
you
At
get
times,
nursing proper.
It's okay.
Nigeria will be teaching something. I will
It's
totally
okay.
lost. I don't know what he's saying.
My
Because yeah,
friend, it's not you alone.
It's okay. It's okay. We are all learning. And
That's
whatever
why the
you learn,
NCLEX
it's not
has
practical.
become very
if
difficult
not
for
this
some of
place,
us.
yeah, some of us, yeah, no.
I
We
think,
you've
but
worked
yeah,
for
that is
years
why
and
the
it's
the
like,
the Eclipse is just being
It's
difficult
okay.
for us because
yes,
It's
we
for
okay.
seem
some of
lost.
us.
We
For
seem
It's
some of
lost.
okay.
us, because it's
We are
like
all
you are now
learning.
starting the nursing school all over.
We
Yes,
are all
it's
learning.
true.
Okay. Even for us who have even written and we are practicing, we are still learning.
Today, but
As
just
in, we are all learning.
is
But yeah,
Mr.
now that you've come to the US to practice, it will be very difficult for you to go back to Ghana and practice as a nurse, because you always complain.
Oh, maybe we'll talk about that later. But just let you know. Okay,
Miss
we
Lane.
are all learning. Okay, please. When you see some of these things, they are very practical. Whenever you pick up a patient, I've said this before. I am saying it again. Whenever you pick up a patient, understand what is going on with the patient. Please don't follow the status quo. Okay, understand what is going on your I don't know. There are some places in Ghana. It's like when you go to the workplace, everybody takes care of anybody. Like no one's accountable for anyone. It is very different here. They assign a patient, and I think back in Ghana too, we have some wards. They will tell you this is your patient, this is your patient. If you are in a system like that, okay, try to understand the patients who are entrusted to you. Know their diagnosis, know their allergies. Okay, know what is going on with them, know their history, if there's any medication that's, I mean, that's their own, and anything that has an issue to do with their safety. And even when you are about to administer any medication, please just take 1 minute or a few seconds and think about maybe contraindications, okay, or think about safety, whether it's good for this patient.
Oh,
Maybe my
oh,
patient maybe my patient is having, or maybe has history of asthma. I've been giving metoprolol to give to this patient. blood pressures are very high, don't concentrate on only the blood pressures. Okay. And even if the person is not asthmatic patient or not, maybe the patient is not asthmatic patient, please, when you are about to just give this medication, you know that with beta blockers, when heart rate is below 60, it is a contraindication. Nowhere in the world can you go scot free when you give it. Okay. Blood pressures can be somewhere 180, 120. It's very high. It's hypertensive emergency. But please don't give your metoprolol. Don't give it. Okay. Or propanolol, whichever beta blocker. Don't give it. Ask. I mean, you can tell the doctor. This patient, even though the blood pressure is high, but the heart rate is 60 or maybe 59, it's likely to go down. And if it's older adults, it's for older adults, their systems are very soft. Okay. With the question that with the addition that our sister said, you know, there are sometimes you go to the ward, you have patients with blood pressures of maybe 85, 60, but you do nothing because mean arterial pressure is above 65. What mean arterial pressure means is that, mean arterial pressure, it is the pressure that is needed to perfuse vital organs. Okay, so if you have mean arterial pressure of above, we have something we call PP. There's some calculation like
Yeah,
something
it's with
perfusion.
the calculation.
What was it?
When you get
Yeah.
BP of maybe 90/40, the way you calculate for the mean arterial pressure is like
Pressure.
the systolic plus the diastolic, twice of the
Two.
diastolic.
Systolic. Yeah.
Yeah,
Yeah.
divided by
Divided
2.
by 3.
So if you get the answer and it's below 65, in some books they will say below 60, in some books they will say below 65, then it means there is poor perfusion. But if it's above 65 upwards, then
Yeah.
patient is okay. So you have to do other assessments
Yeah.
and work on that one and leave the BP if it's okay. But if it's
Yeah.
below 60 or 65, then there is a cause for concern.
Yeah. So I was even So that is true. That is very true. I was even trying to link it to this CPP. Okay, cerebral perfusion pressure. It has something to do with ICP and MAP2. So depending on the patient. Okay, let's say but generally on the NCLEX, let us stick to mean arterial pressure of 65 and above. Okay, anything below 65, we should not encourage it because about 90 95 to 99% of everywhere in the world, they use they use the 65 and above. Okay. So
Sir,
let us keep it at 65 and
sir,
above. Yeah.
please, what's the formula for calculating the mean as? Can you come again? They said systolic
I'll drop
over
it.
twice.
We have two formulas. When I say it right now, it will confuse you. I'll drop it in the page, okay? When we are
Okay,
done,
sure.
so that you will know it. Yeah. I'll drop
Okay,
it. We have two formulas, okay? So you
okay,
pick
sir.
which one that you can. All right. So I mean, generally, to round up everything, we have a lot of things I can say. Um, Let us be very, very mindful of the things we do. Um, I just want to even end that because otherwise I'll end up talking plenty. Yeah. Eva, your hand is up.
Bonjour, please. My question was I wanted to find out that with the side effects that is on your screen, does it
Uh-huh.
apply to all the examples? And if yes, are they normal ones that we should like when we see them, it's normal, or when we see them, it's for concern? That was what I wanted to find out.
So they all can cause dizziness, drowsiness. When you see confusion, you have to. It's a cause for concern.
Okay.
Confusion, suicidal ideations, these two things. Okay. For
Okay.
balance problems, which increases fall risks, this is like precautions that you have to take. okay, because of the drowsiness and the dizziness. Okay, but for these two things, confusion and suicidal ideations, it's a major concern. So these two. All right.
Okay. Thank you.
You're welcome. Let me see. Please let's
Hello,
look at this one
Sage.
before we go. Okay. Yes, sister.
Hello.
Or maybe time is up. Yes, sister.
Please, I want to clarify
Okay.
something.
Okay.
For the map that we were talking about, if you check the BP and let's say the systolic is below 90, and then the map is within normal, do you still prioritize?
No.
The systolic is what? Below 60?
90.
Below
90.
90, and what?
Yeah. And the
The
map
map
is
is,
within normal. Do you
then
have
it's
to
normal.
still prioritize?
No, it's normal.
It's normal.
Yeah.
Okay.
So
So,
when you get I saw one kill bank under DIC, and the
okay.
BP was very low. So what the immediate concern, you might go and choose the BP.
Mm-hmm.
But that was not the concern at all. The concern
Good.
was on the platelets.
Good.
Meanwhile, the BP was very low and the person was oozing blood. But they said
Good.
the BP, because the map is within normal, that
Yeah.
one is not our priority.
Yeah.
So
So,
anytime
I'll
you
give an
see the
example.
BP, just calculate your map and see. If it's
Yeah.
okay, then you put that one aside and concentrate on the rest.
Yeah. And when you get questions like that, they will even tell you, they will even give you the map inclusive. Okay. So, um, even if you have 80-50, I don't know whether the map, when you calculate the map, will be below 65. But if only you have a map of 65 and above, you are okay. All right. So no matter how bad or how weird the blood pressures are, if you have a map of 65 and above, it means vital organs are being perfused and you are okay.
Okay.
Me at first
Okay,
I
thank
didn't know,
you.
so I chose the BP one when I had it
Okay, okay,
wrong.
okay, okay.
Oh, okay. All right.
So we are all learning.
Yeah, we are all learning. Any
Yeah.
other question? So I think I will touch on this. We are almost 10 minutes past time. I'll touch on this, God willing, tomorrow. For this one, I have a lot of questions to ask. Okay. I have okay, when we come tomorrow, we talked about all of these things yesterday. Yeah, so even if you forget about everything, please look at this one. This and the next slide. Even if you forget about everything, please don't forget about these things, about anti-seizure medications, anti-epileptic medications, or anticonvulsants. Okay. One, when you are giving them, you have to monitor for seizure activities. Okay, very important. You have to monitor your CBC, okay, your complete blood counts, your liver enzymes, and your kidney functions. Okay, you have to monitor these things. Then you also have to monitor drug levels, okay, so that you know whether they are in their therapeutic forms or they are in their toxic form. Okay. Then the next one is seizure precautions. You have to make sure that your seizure precautions are in place. Okay, we all know the seizure precautions we are talking about. Um, Seizure precautions like padding of side rails, making your suction sets ready,
Your oxygen,
your oxygen. Good.
nursing patients on low beds,
Yes, yes. So the bed has to be very, very, very low. Okay.
and
Then you have
loosen
to
all
make
tight
sure.
clothing.
Come again.
Loosen all tight clothing.
Yes, yes. Hospital gowns are already loosened, right? You see how it is.
Yeah.
Yeah. So you don't tie the neck or something. So they are all part of um, seizure precautions. They are very important. Then one thing is do not stop medication abruptly. Please, you see all these bulleted points here. There are a lot of, remember, yesterday I promised you a lot of questions, about 10 or 11 questions. Some are very easy, some are very tricky. I mean, trickish, right? Some are trickish. You will have to maybe look at it well before you'll be able to answer. Okay. So we'll get there very soon. So even if you forget about anything about antiepileptics, some of these things, I mean, these things, they run through all of them. So don't forget. Do not stop them abruptly. Okay. Avoid alcohol and other CNS depressants when you are taking them or when you are administering them. Okay, because they all have sedative properties. Okay. All right. Then when you look at the right side, okay, right hand side of the screen, client teaching. We are saying that we teach clients to take medication exactly as prescribed. Okay. If there will be any changes in dosages, it should be done by the healthcare provider, not you. Carry medical bracelets or medical alert bracelets, okay, so that at least if there's an emergency, people around can know how best they can help you. Right. Then avoid driving until your seizures are controlled. Okay. Report rash immediately because it could be a reaction. Like the commonest one we have, which is Steven Johnson syndrome, it could be the beginning of it. So report rash immediately. Then maintain regular blood tests. Okay. It's in line with some of the things we mentioned here. Okay. And avoid abrupt discontinuation. Okay, which can cause what? Status epilepticus. All right. I think this one is clear enough, right? Now, to end the whole thing, when you see rash, like I was saying, it could mean possible Steven-Johnson syndrome. When you are taking and there is fever and sore throat, it could mean what? Blood dyscrasias. Franklin explained this one. You remember? We even mentioned agranulocytosis, something like that, right? As part of it, okay. And we have other forms of blood dyscrasias. Respiratory depression, okay. Respiratory depression can also happen, okay, especially when you give diazepines, benzodiazepines, and barbiturates. These are very fast ones, okay. Remember, we said benzodiazepines are first line treatment, okay. Benzodiazepines are first line treatment for seizures. So when you have lorazepam or let's say diazepam, and you have phenobarbital, you have phenytoin, you have levetiracetam pepper, and patient is having tonic-clonic seizure, which medication will you do? Your answer is your
Yeah, yes,
benzodiazepine.
they say benzodiazepine. Okay.
Yes, so that's your first line. All right. And they cause rapid because it acts faster. This thing can also happen faster. Okay, respiratory depression can be very, very fast.
Hello,
Whenever you
sir.
hear, yes.
It's yesterday. I also saw in a Q bank that you give phenytoin first. So I was confused. I don't know which you put.
So generally, I don't know how you saw it. You can send me the question, but generally, when someone is having active seizures, phenytoin is not a first line action. It's benzodiazepines. Okay, you can do other searches and see, but you can.
Okay.
I'll be glad if you can send me that question to personally.
Okay.
Yes, you are welcome. And like I was saying, whenever you hear of the gum, okay, the gum like gingival hyperplasia, think of what? Phenytoin. That is the only anticonvulsant that is capable of causing gingival, or I don't know how people pronounce this, gingival or gingival or whichever. So gingival hyperplasia. Okay. Uh-huh. Then we said the therapeutic levels of phenytoin is 10, 20. So you see the previous slide and this slide, even if you forget about all that we've discussed on anticonvulsants, these two slides, don't forget, at least you've learned something. Okay. Do not stop them abruptly because they can cause status epilepticus. So this one and this one, at least don't forget them. They wrap up a whole lot. Okay. If you have any question, ask before I start asking my questions. I think my questions are next on the page. All right. If no question, let's take our first one here. See, these ones are very, very easy. Can someone do it for us? Can I get a reader?
A client
A
with
A
client.
client with, okay.
Clients with a seizure disorder is prescribed phenytoin. The nurse reviews the
Now
client's
I
laboratory.
can hear your voice. Your voice is very, 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 very down. I don't know if it's
Hey,
Yes,
okay, let me
your
try and
voice is
shout.
low.
your voice is very
A
low.
client, and then let someone else read.
Okay.
A
a
client with a
client.
A
seizure
client,
disorder.
Okay, if you want to read, raise up your hand. Let me see. Yeah, let me call someone. Raise up your hand. Otherwise, everybody will be reading. Oh, no one wants to raise up their hand. Everybody wants to read, but no one wants to raise their hand. Okay, Teresa. Okay, Oforiwa, good. Oforiwa, let's go.
A client with a seizure disorder is prescribed phenytoin. The nurse reviews the client's laboratory results to evaluate whether the medication level is within the therapeutic range. Which serum phenytoin level indicates the medication is at a therapeutic
C.
level?
C.
See,
A.
This one, if you are here, you don't know. Raise up your hand
Uh,
and let us
C.
clap.
C.
We
C.
even
Okay,
just heard
We
it.
will let you finish. C.
okay, good, good. So you see what we were talking about,
phenytoin is
the
10 to 20
interpretations, okay? When you
milligrams.
have higher above the highest cutoff point, that could mean what? Toxic levels, right?
Toxic
When you
levels.
have it within the desired range, that is therapeutic. When you have it below the lowest cutoff point, that is under the therapeutic range. That's
Therapeutic.
subtherapeutic.
Subtherapeutic.
And if you want to know how, so use this one to take notes, okay? Use this slide to take notes. Patients have been taking phenytoin, and patient is having ataxia, confusion, lethargy, slurred speech, any of this, or nystagmus, even if one or two of these things is mentioned. If one is mentioned or two of these things are mentioned, and the person is taking phenytoin, think of phenytoin toxicity.
Overdose.
Toxicity.
Okay.
Toxicity.
All right. Our next question.
A client has been prescribed phenobarbital for seizure management. Which adverse effects should the nurse prioritize monitoring? A. Hypertension. B. Respiratory depression. C. Hyperactivity. D. Diarrhea.
This is also very easy, right?
Yeah.
What is
Yes.
the answer?
B. Respiratory depression.
So is pharmacology difficult?
Hey,
Yes.
yes. Oh,
If you know
unless
it,
you
it's not difficult. If you don't know it.
You so we will not waste time on this one too. Okay. Please, if you are here, solve some more. So, otherwise, we will go and leave you behind. Our next question.
A nurse is providing discharge teaching to a client prescribed phenytoin for seizure control. Which client statement indicates that the teaching has been effective? A. I'll stop taking the medication once I feel better. B. I'll use a soft toothbrush and floss my teeth every day.
B.
D. I'll take this medication at the same time as my antacid. D. If I miss a dose, I'll take the 2 next time.
Take your time before you select the answer. Hmm.
Say B.
B.
Because I said take your time before you select the answer, some people's mind are changing, right?
B.
I can
The
read
answer is
Police
B.
mind.
B.
Why is
B.
she wrong?
In fact, my mind they see pound.
I'm reading people's
The
mind here.
modifying phrase, the first statement is right, but the modifying phrase, which is
The antacid.
as my antacid, yes.
So antacids reduces,
So it's
or let's say antacids reduce the efficacy of
Absorption.
lots of medications. Yeah. So most of the times antacids are not advised to be combined with almost all medications or most medications. Okay. Most of the times it's either 1 or 2 hours apart, right?
Yeah.
1 to 2 hours apart before you can take your antacids or different medications, right? You don't have to take them together. Okay, so we all understand the answer is what? B. If you don't understand, let us know. So why B? Who can give me a quick rationale? To
Yeah,
prevent
please, I
what?
don't understand.
Okay, good.
Bleeding
So those who are
precaution.
choosing B,
And also for
It
the gum.
because of gingival hyperplasia.
yes.
good,
Because of the
good.
hypertension.
So you see,
Yeah.
everything that we learned was more of the gum of in the gum, right? Remember there was a time I told you, even when they tell you like mouth care, proper mouth care, you should link it to it because at the end of the day, it will affect the gum, right? So it's not always that they are going to mention like a gum something or gingival something for you to just put the answer right away. They will be playing around it, right? So if you're able to use a soft toothbrush and you floss your teeth, okay, flossing the teeth is in question, but using a soft toothbrush makes it safer, okay, which helps to keep the gum clean and prevent complications. So you ask yourself, among these four options here, which one is likely to help keep the gum in good shape? That is B. Okay, that is B. So that is how the English sometimes tries to throw your mind away. Do you understand it?
Yes, please.
Yeah,
Yes, please. Thank you.
you are welcome. So Phenytoin is the only drug that they will ask you to do your mouth care well, take care of your gum and all of that. So take note of it.
So, boss, please, what about the other one? I think there are two.
Which other one?
I think is it oh, I've forgotten the name. There are two drugs together with the phenytoin under their
It
Oh,
was
okay.
specification.
phenytoin.
It was floral BB phenytoin,
Is
right?
it
No,
for
it was
Phenytoin?
Post
phenytoin.
Oh, okay. Yeah,
So for
so
that one,
it's in
it
the
doesn't
same
cause.
class, right?
Okay.
It's in the same class. So yes. So I think thank you for that one. So it means when you're caring for a patient on any drug that has phenytoin attached to it, okay, whether phenytoin or phenytoin itself, gingival hyperplasia is a complication. So mouth care, anything that has something to do with proper oral hygiene.
Sure. Okay.
Thank you. And you see this one too. Sometimes they will also link it to visiting the dentist regularly, okay, or dental clinic. So you can link it that way. All right, our next question.
A client is actively experiencing status epilepticus. Which medication should the nurse anticipate administering first to rapidly control the seizure activity? A. Phenytoin. B. Ethosuzumide. Who said
Uh,
it?
boy.
Phenytoin.
Etho what? Please help me here.
It's C.
Okay. C.
Etosuximide,
Ethosuzumide.
lorazepam and carbazepine. Sorry,
Ethosuzumide.
carbamazepine. Sorry.
And D.
So the answer is
Carbamazepine.
C.
Yeah. So
The
you
benzodiazepine.
good. So you see this is a clear question.
You know.
Okay. So it's like I've almost it's like I've said everything that I'm about to ask you. I've said everything during explanations. Okay. So if you listen to everything we said very well, this question should be very easy for you. Okay. Okay, now let me reframe this question. A client is actively experiencing petit more seizure.
The
Which
answer is
The
B.
medication?
answer is B. The answer
The
will be
answer
Okay,
B.
is B.
good,
Yeah.
B.
good. Hey, some people are wild. Let me reframe it again. A client is actively experiencing absence seizure. Which medication should the nurse anticipate administering first?
But we just
The
did
answer is
is
B.
it's
The answer is
The
also
answer is
B.
B.
Some people are
B.
confused.
So
Some people are
B.
please
saying
You
A.
can
said, you said absence seizure,
Yes.
Absence seizure.
right? Yeah. It's B.
Another name for
So the
absence
same
seizure
as
is what?
petite ma.
It's petite mal. That's what you said
so,
the other day.
so please can someone briefly explain that why it is B? Some of us maybe during the previous lecture were not around.
So according to him, this medication is used for the management of absence seizures, which are also known as petite mal. So they are seizures that sometimes occur in children, and then they take about 10 to 20 seconds to occur.
Oh, okay, thank you so much.
Okay. So when you hear of petite more seizure or absence seizure is the same thing. Yesterday we talked about it. Where someone will be staring, okay,
Steroids,
referring,
yeah.
yeah, at
10
a
to 20
place,
seconds. Yeah.
yeah, for about 10 to 20 seconds.
20 seconds and then they'll
Like
come.
the person will lose consciousness. Not like the person will close the eyes or something, but it will be like a
Lost in
blank
thought.
stare. Good, a blank stare like that. All right. So remember we said this etoxoximide is mainly used for only that one.
That one.
Yes, only that kind of seizure, absence seizure or the petite more.
Petite mal.
Okay. So that is why I reframe the question in that way. Just to test you whether you still remember. Okay. Prissy, your hand was up. Are you okay now? Okay. So this is our rationale. It's even here. Okay, so look at the rationale very well. Can we carry on?
But please, I had a question
Okay,
about the phenytoin. The
okay.
the gingival whatever. Is it
Hey, not whatever, please. Hyperplasia. So, uh-huh,
okay, good. I didn't
uh-huh.
want to bite my so please,
Okay.
is it a side effect or complication? Are we expecting it or
So it's a side effect, is an adverse effect, the complication. We don't expect that, but it's likely to happen. So when it happens, you have to inform your healthcare provider. Okay. Yeah. So, and the question is, you see it as side effect, you see it as adverse effect, you see it as a complication. But please, it doesn't mean that anyone who takes phenytoin, after all, a lot of people have given phenytoin here before, right? Do we normally see them? They are not common, but they are likely to happen. And when they happen, you don't have to sit down and say it's okay, it's phenytoin. Okay, you have to inform your healthcare provider. Maybe if it's oral care that maybe the patient needs, it will be done to help prevent that. If maybe like we've done everything and it's still happening, the healthcare provider might try to change the anti-epileptic or anticonvulsant medication. So it's something that when you see, you have to report. You don't have to just sit down and say maybe it's a side effect, so that's okay.
okay, thank
Do
you
you
so much.
understand?
Yes, please, thank you.
Okay, welcome. Any other question? Okay, I think we can move on now. The next question, huh?
A
Where's my
nurse
reader?
is caring for a client prescribed carbamazepine for seizure control. Which serious adverse effect should the nurse closely monitor for while the client is taking this medication?
Mm-hmm. The questions are very easy, right?
Yeah.
Is pharmacology difficult?
It's difficult when you don't know,
Exactly.
but yeah,
So
you
you,
haven't studied enough.
So you have to know.
yes. So I want you to admit, like, I want it to be easy for everybody. So normally I want a straight answer. No, it's not difficult. You know. All right. Please, who doesn't understand why the answer is bone marrow suppression? Anyone here with a question? So we discussed this in live class already, right?
Yeah.
Yeah. So there's a rationale.
All the
Quickly,
first
we can read it before we carry on.
Blood dyscrasia.
Yeah.
Yeah. So all these things you see here, they are examples of what disgrace, yes, that we were talking about. Okay. The word is big, but it simply means these things. Okay. All these are blood disgraces. Okay. Can we carry on?
Yeah.
Our next question.
A client is receiving oxycarbazepine to control seizures. What statement by the client to the nurse indicates an understanding regarding administration of this medication? 1. I need to take an additional dose when I'm having a stressful day. 2. I will be able to stop taking this medication in about a year. 3. I will probably need to take this medication all my life. 4. I'll never have another seizure if I take this medication.
Yeah, so you see, my tricky questions Sorry for the sound, okay? So my tricky question starts from here. Let's see. Some people were answering the questions before our sister could land. Where are you? Are you hiding your faces now?
We are here.
Yeah. So who wants to try and tell us why you chose your
Three.
answer?
Three.
Your reason?
Sir, I think it's three because until the doctor tells you to stop, you can't stop the medication.
That is for two, right? That is option two explanation. Why it is incorrect.
Say,
Yes.
I'll go for three. Like yesterday, we
Okay.
said it's a long thing, like it's used for a
Okay.
very long time.
Chronic, yeah,
So
Okay.
mental.
that's my rationale.
Okay. Okay. Yeah, I don't want us to spend a lot of time there. Yeah, so you had it. Okay.
Yeah.
Yes. So this is the short rationale to help you understand. And please,
Yeah.
if you still don't understand, you can let us know. Okay. Can we carry on? Okay, our next question.
When caring for the client who is receiving phenytoin, the nurse emphasizes meticulous oral hygiene to the client. This nursing intervention is based on the nurse's knowledge that phenytoin has what effect on oral tissue. 1. It causes hyperplasia of the gum. 2. It increases alkalinity of oral secretions. 3. It erodes and destroys tooth enamel. 4. It promotes bacterial growth at the gum lines.
This
This
one,
one too is bold also.
it causes
One.
hyperplasia of
Yeah,
the
it
gum.
causes
This one too is
hyperplasia.
bonus, right?
It's not
Okay.
tricky at all.
This one is not tricky. Yeah, I know. Can we carry on?
So, boss, please, when we look at this particular question, can you go back? So let's assume number one wasn't there. Can number four be the answer, the probable answer?
No,
No.
it doesn't
If
promote bacterial growth.
if one wasn't there, then probably three
But
would be closer.
three would have been the era.
Okay.
And
No, three cry is
three
not
two is
close.
not,
So it cannot
yeah,
destroy
three two is
enamel.
different.
No, no.
And
It
I'm
doesn't
already
destroy
oh,
enamel.
okay.
So whatever it is, one should be there. Okay.
Okay. Thank you.
All right. Can we carry on?
Yes,
Yes, please.
please.
Okay, our next one. Now let's see about this.
The healthcare provider prescribes phenobarbital sodium for a client who has had a tonic-clonic seizure. What statement indicates to the nurse that the client understands the side effects of phenobarbital? Select all that apply. 1. I can expect a loss of appetite or persistent fatigue. 2.
So wait.
Yeah.
Because this is also select all that apply question, let us do it together, okay?
Mm-hmm.
So let me pick up my pen. The first one, do you think the first option is correct or wrong?
It's correct.
Why do you think it's correct?
Most of these medications they can cause fatigue for some time, which goes away as the patient is taking them.
Okay. Okay.
So you
Do you
expect that
agree?
fatigue will occur, but
Yeah.
as the patient continues to take them,
Someone is saying yeah, but the yeah is like yeah.
Oh, it's
Yes,
correct.
actually, it's
Okay.
true. Yes,
What
it
about
can
option
cause.
two?
Yes.
Yes,
Yes.
Yes.
I might.
Okay.
Yes.
Balance, yeah.
Yeah, false and like it's a
So,
false.
so you see how we are analyzing everything together here. When
Yeah.
you are alone and you are doing your select or that apply, try and apply, like learn something from live class and apply when you are alone. Okay, that is how you build your your own
Mm.
strategies of answering a test type of. Know why you choose your answer. Okay. What about three?
I have something that is
Diarrhea
around the
accompanied by
common.
Nine.
Mm.
malnutrition is common.
As for diarrhea, yeah, no,
No, no,
it will
it
rather
cannot.
cause constipation.
Yeah.
Okay, so no. Option four.
It's
Decreased tolerance to
Nine.
common food can occur. No, it cannot. Not a known side effect. No.
Option five.
the level
Yep.
of the common
Yes,
difference.
yes,
Yes.
Yes, yes,
yes.
yes.
First.
Barbiturates
It's
can
the
cause
level of
that. So yeah, it can cause mood change.
Do you all agree that the answers are one, two, and five?
Yes, please.
If you agree, raise up your hand. Let me see.
But sir,
Okay,
please, what
so
the difference between 1 and 4?
one and four.
One, yes.
I can expect a loss of appetite or persistent fatigue. Okay, and four is what? Decreased tolerance to common foods can occur. Loss of appetite is different from tolerance.
you can't
Tolerance means
evolve
you can have
anything.
the urge, but you are not tolerating it. This one is you don't have the edge at
You
all.
don't have the edge at all.
This one you can be very hungry and you can be very like active in eating and all of that. Okay, but just that when you pick up any food or like you take the food, you don't have tolerance. Okay,
Yes.
tolerance. The word tolerance means like I don't want to use the I can't dialect, but it's like um a food that disturbs you, like you your body rejects it. Okay, so maybe you can have diarrhea, serious diarrhea when you take it. Okay, or something like yeah. I don't know if there is any different way someone can explain tolerance, right? But if you have decreased tolerance to common foods, that is what it means, right? So can this medication cause that? Linking option one and option four, they are different things. Do you understand it? Is the one was the question here, or you still don't
Yeah,
understand it?
yeah, I understand.
Okay. So are we choosing one? Oh, we have hands here. Some hands were up. Let me see.
Yes, I
Oh, they are all
wanted
down
to
now.
add up, but I think you've explained it. I wanted to say
Oh,
that
okay.
the option one is like a general body effect, which is like you said, the fatigue, like low energy and other things. And the option four, which is it's more like a coordination or a balance, if I'm right.
Okay.
Yes. So like you are feeling faint or dizzy or something. That's how I see it.
Okay.
Yeah.
Okay. All right. So do you all choose 125? Some people don't have the courage to proceed. And some people are choosing their own answers backstage. I've seen you, okay? Now, if you choose your own answers backstage, mark yourself now and let's see what you had. So you see, are you getting the trick? The words on the ankles. This question is from Pearson, one of Pearson Pearson people, their textbook. Okay. I picked this from from there. Look at the kind of words or the wordings that they use. Persistent fatigue. Okay. So if you are not smart, nothing will click on your mind that we are talking about sedation. Because you
Sedation.
know that barbiturate what? Sedate.
Dates.
Have you seen it? And if you are being sedated, and also as part of the common side effect of this drug, you lose appetite. Okay. Lightheadedness. Then when you see something like off balance, ataxia or dizziness, it is also in the same line. Okay. When you are being sedated, you can have any of these things happening. Okay. And the medication can cause depression or mood changes. And the last one, it can cause what? Respiratory depression. Any question?
So it does not cause diarrhea.
No.
No.
Okay.
You chose diarrhea as part of your
That's what we
sedation.
chose, yeah.
We didn't choose diarrhea.
We chose it.
This one,
We
we chose
did
125.
1, 2, and 5.
We didn't choose diarrhea.
Boss, we chose it. We chose 3,
We didn't
please.
choose diarrhea.
Oh no, we
we
Hey,
didn't.
chose
We didn't
diarrhea.
choose it.
No, he said
So,
diarrhea
Because
is most
one,
Because
two,
most of
part.
the
and five.
medications cause constipation.
so you see
He
that
said
we've caught her.
you sure?
constipation rather.
Yes, we
You see
Yeah.
that
didn't
we've caught
choose
her.
diarrhea. It
She,
was
He
she
one,
said
chose
two,
it
and
in her
5.
mind.
constipation.
She chose it in her
Adani
mind.
Tokwana.
You see, she chose it in her mind. So that is how it is. We've caught you, right? Okay, our next question anyway. That's interesting. Hmm?
A client with a history of seizures is admitted with a partial occlusion of the left common carotid artery. The client has taken carbamazepine for 10 years. What is the most important nursing consideration when planning care for this client? 1. Obtain a history of seizure incidents. 2. Place an airway, suction and restraints at the bedside. 3. Ask the client to remove any dentures. 4. Observe the client for increased restlessness and agitation.
Wow, this is interesting. It's like
102.
it's between 2,
2.
2 and 4.
Please, you can't say 1 or 2, or you can't
It's
say
2.
between two or
I'll go for
three or
2.
four. Choose one.
I'll
Well,
go for 2.
the
So
part
choose
was
one
talking
and
about
pass,
what is
or
the
choose
most
one and
important
fail.
nursing consideration? Two. I'll consider two.
I'll consider 2 as well.
Okay, if you are here and you agree to two, raise up your hand. Please, if you don't
I'm
raise
going
up
to
your
use
hand,
my
don't say
hand.
you said it all.
Observe
Some of
the
us are
doctor.
raising up our hands in our
So,
minds.
Okay, all right.
Sir,
Okay, so you have
hello,
option two.
sir.
Which one? Yes. Which one again?
Yeah, please. I like the option too, but the restraint is the issue. Why restraint?
Yeah, it's true. Then
okay,
I'll go
I'm
for
not
4.
sure.
I'll go for
I
4.
Well,
know.
are you
Observe the
asking
client.
me? The
So we
question
don't
is there
restrain
before
them.
you. So
We
why are
don't
you asking
I'm
restrain.
saying that we
me?
don't restrain them.
Yes, we don't.
Observe the client for the
Sir, please, I'll go for 4. I'll go for 4 because you observe the client for increased restlessness and agitation. I'll go for 4.
Eh,
Are they allowed
this
to
One.
one thing.
change their answer?
Yes,
One.
Yeah, 1.
Yeah,
I'll
I'll
go
go
for
for
4.
1.
I'll go for 4 because
Okay.
I have a feeling that it's 4.
Finally, let us see the answer.
Um,
Mm-hmm. 1.
Yay! One.
Yay!
Yay! One. Hey, sir. One pa.
You see, one option one is not looking appetizing, right?
Mm-hmm.
It will not look attractive for you to even pick it. That's how NK sunsets look like sometimes.
Please,
Do the
can you go
rationale,
back?
let me see the
then you
Can
rationale
you?
pick it.
again.
Okay.
So
Let
first
me
of all,
go
look
to
at
the
the question very well. Those who wants to look
Yeah,
at the question again.
then yes. You need to obtain history.
But the question of I've already told us that the client has a history of seizure. So why obtaining
For
Yes.
10 years.
like
So why do
Obtaining
you
a
still have to
history. Me,
obtain?
I feel
yeah.
like it's four. It's four because
Somo boy.
because
obtain
when it comes to
history for
prioritization, right?
Uh-huh.
I feel like
no
neuro change. Four sounds like a neuro change: increased restlessness and agitation, right? And it's a neuro something. So prioritization, I'll prioritize that one first, which is the fourth one first, because already they've given us a history.
But
So
they are saying incidents over here, incidents,
Incident,
like how
seizure
often
incident.
it occurs.
Yes,
So,
yes,
how
yes.
often that seizure
the person
occurs.
has
So
taken
it's
the
very
medication for
important.
10 good years.
And
yeah,
during the seizure too, with the incident, are there any falls? Does the patient has risks for falls safety? So
Yes,
this one will guide the nurse in the way to manage the client based on the safety precautions.
yes,
Hmm.
yes. Because I saw a question, that's how they explained it. They said
I
you have
am
to know
I am
details
enjoying I
about
am
the
enjoying your discussion. So do you know something? Do you know something? Yeah, so this is also a good thing that has come up. Please remember I normally say this when you are doing questions, read the words word for word. Well, I have experience. I don't know, maybe most of you too have experience. Any single word used in the question is very, very important. When you go to the English, sometimes you are unlikely to meet little things. Okay, their wordings can be different, but please pay attention to the words that they use. You will take a particular word lightly, but that word is the key to your answer. Okay, so a client with a history of seizures, the person came and they've told you that, yes, so I've been having a seizure. Okay, maybe I'm the one, I come to the hospital and I, maybe as part of my admission test, I tell you, yes, so I've been having seizure. Okay, yes, it's part of my history, and I mean, blah blah blah, all these things added onto it. Okay, the client. So let's say if I'm the client, I've been taking carbamazepine for 10 years. What is the most important nursing consideration when planning care for the client? So looking at this, observe the client for increased restlessness and agitation. Does it help? So you see, this is the question. Okay, what's the most important nursing consideration when planning care for this client?
Mm.
When you observe the client for increased restlessness and agitation, how does it help in your planning?
mm,
Anything or anything, can you think of anything to link it to something that you can do if you observe clients for increased restlessness and agitation that can help you plan well for the clients? Is there anything here that can help you plan?
Okay, please let me share my small
You see,
opinion.
so when you obtain a history of the seizure incidents, okay, what normally triggers it? That is one. For how long? Okay, what is the nature? Okay, because for all you know, this said seizure, so it can be any form of seizure. It can be maybe tonic, or it can be even tonic-clonic. It can be any type of seizure. This is what will let you know the kind of seizure and how you can plan with your precautions and everything. Okay, so the incidents, you don't throw away the incident. Seizure incident is telling you some history of seizure incident. Please, do you understand?
Yeah.
Yes, please.
Yeah, so um, that is how it is. We can look at the rationale to add up additional meaning. Okay, so you see, assess seizure history. So the frequency, the triggers, then the last seizure, okay, even for how long it lasts and all of that. They are very important for you to plan well. Some of these questions, when I see them, I try to bring them up to help so that we can all think outside our scope. Okay. I think it's fine, right? You can look at the next question. I think after this one, we have one last question, then we continue. Maybe one or two. Yes.
A client with a history of seizures is scheduled for an arteriogram at 10 a.m. and is to have nothing by mouth before the test. The client is scheduled to receive a daily prescribed dose of phenytoin at 9 a.m. What action should a nurse take regarding this situation? 1.
It's very easy.
Omit the 9 a.m. dose. 2. Give the same dosage of the drug rectally. 3. Ask the prescriber if the drug can be given IV. 4. Administer the drug with 30 ml of water at 9 a.m.
Sounds too easy. It's pharmacology difficult.
Yeah, I'll go for one.
Administer the drug.
Yeah, I'll go for 3.
I'll go for 4.
3.
Please take your time and look at the take your time and look at the options before you choose your answer. The answer is there. The correct answer is there. The wrong answers too are plenty there. Okay. Who said she will go for one?
You'll go for what?
Who said she will go for one?
I'll go for 2.
Okay. For 2, tell us why.
It's no per us. So rectally, I don't think it have any effects there.
Do we have rectal form of phenytoin? So that would be my next question.
No.
No,
So,
hands out.
even if
Tell
we
us.
have, can you go out of your way to give
You
it
see,
rectally?
this is a very nice. If you look at it well, this is a very nice option for you to pick. Okay. One is that, so yes, we all understand the fact that the patient cannot miss the 9 o'clock dose,
Drug.
because when patient misses it, do you know that the patient can even arrest during the procedure?
Yeah. There
Yeah.
can be
Okay,
subtherapeutic.
yeah, patients can. I'm saying arrest. Sorry, patients can even have seizures. It is possible. Okay, during the procedure, which will even be very, very worse. So, in order for patient to still receive his or her medication, at least IV can be given.
IV. Yeah.
You see that
You
this
get a
question is not
prescriber to
easy.
change it.
Sorry, you see that this question is very easy, but
But tricky.
if you don't take your time, you get it wrong. It is very easy. Okay, so let us
So,
slow down and take it easy. Uh-huh.
also with that too, sorry, since the drug is already prescribed as oral, as a nurse, can you actually change the route of medication without contacting the prescriber since we don't prescribe drugs?
No.
No,
Oh,
you always have to contact. So
yes.
in
Yeah, so
questions,
that
either
is
you
why
see
it was.
in questions, either you see contact or maybe call pharmacy. Okay, either call
Okay.
pharmacy or call the doctor. So either of them, one of them can do that. Okay,
Okay.
I've seen
So it
questions where
makes you
either
wrong.
pharmacist or
Then
the
4 days wrong, cry. It's not even bad.
yeah. All right.
Yeah,
So this
please,
is the rationale.
I have a question. Please, I have a question about this one.
Okay.
Hello,
Yes,
please,
sister, I'm
can you
here.
hear me?
Your
Yes, I
line
can
is
hear
Eh,
you.
breaking.
okay. Can you hear me now?
Yes,
Yes,
please.
please, I can hear you.
Okay. Please, with this question, what if you are given an option to withhold the medication till the patient is back from the procedure that the patient was going for? You see, the gist you gave us today, you were supposed to give, I think you were supposed to administer an antihypertensive, but you withheld it because of the patient's condition. This one is MPO. So can you withhold it when the patient is back from the procedure? Then you give, if you have such option.
Okay. So let me tell you something. It's a good example, or it's a good something you brought up. Um, when medications are ordered, okay, to help treat certain conditions, and you refuse to give, or you even delay to give, please, you can be called to face corrective, the corrective team, or maybe you can be called to answer questions. Okay. Let me give you one example. Um, it's like a lot of things have happened and I can even relate. Okay. So let me use myself as an example. Last 2 weeks, my assistant director texted me and was asking. So you see, the last time we were telling you nothing, I mean everything you do over here, you leave your tracks. Okay. I was supposed to give an antibiotic. I went for night. I was supposed to give an antibiotic. I scanned everything. I think it was scheduled for either 12 or 1 a.m. The patient was very agitated, and he would not allow me to touch him. And any move that I make, he will even try to pull out his IV with the connection that I tried to do. Okay. So what I did was I was able to scan everything and I hung the medication. I just delayed it. Like you can delay, there's an option you can delay the infusion. So I was like, I was able to give some medication. I gave trazodone. I gave some medications to also help calm the patient down. So my plan was that after patient has calmed down, then I quietly connect the IV to his line, okay, so that the patient can receive his antibiotic. Because I didn't want to chat patient refuse, okay, because unless maybe there's evidence that patient refuse, and when patient is refusing things like this, you have to call the doctor and tell them the document, and the doctor too will be aware, so that when there's any issue of why you didn't administer, the doctor is aware, you're also aware, everybody has documented, and nobody gets the punishment. Everybody goes scot free. So I delayed it for some time because the patient was very, very bad. You Infections, like very, very bad. Do you know that I was called last? I think the thing happened like about a month ago. I think they were doing some reviews or something. And my sister director, she texted me. She was like, on this day, safety event was recorded on their system, and I delayed it. It was noted that I delayed an antibiotic. I delayed an antibiotic. So she was asking, what is the cause of that delay? And I explained everything and on the ward, whatever thing that happens, you have other staffs also paying attention, bearing witness and all of that. And I told her patient was very agitated and wouldn't allow me. So I didn't want to just chat it off. So I just delayed it until patient was calm before I reconnected. And he was like, okay. So you see, antibiotics, if you refuse to give antibiotics and patient condition worsens in the US, or I don't know about other places,
Right.
please, you can who has seen this English question before? I think it's about meningitis or something. The first thing to do, like they stress on giving you antibiotics, first dose, like giving it quickly. Is it meningitis or some other like other bacterial infection? Who has seen questions on those areas before? I wish I can remember this question. Like, please,
I saw one
is that
question on
share
so and they said you should give the antibiotics right away.
antibiotics good right away if there's any infection? Okay, no matter what is happening, if things are going worse, anything in the place, if it's bacterial infection, most of the times on the end case, your first option is likely look at it well. Your first option. I'm not saying it's always like that, but about 80 to 90% of the times your answer is likely to be give your antibiotics first when it comes to bacterial infections. You don't want to joke with it because um, if you delay in giving your antibiotics or if you refuse giving your antibiotics and something happens, over here I've seen one. Yes, was it last week? I saw one staff who was being reported to the boards, and she had to face. I mean, she was given a letter. And all those things that we are learning on the ethics, like we are unfolding one by one. When you look at ethics, those of you who were here when we did ethics and ethical principles, we studied those things. And I'm seeing when I see some of them, I'm like it's like I'm watching video, that they are happening, and they will send you a letter. And this person was reported because the doctor ordered what was it? We have is it Dex? We shorten it as Dex. Okay, it's a sedative over here. Okay. Let me see if I can remember the full name, but we normally shorten it as Dex here, not hexametazole, not uh, but I'll give you the name. Okay, it's Dex. So the um the doctor, it's the doctor ordered the dose to start at a particular rate. Okay, yeah. So the name of the drug is dexmedetomidine. Okay, dexmedetomidine. It's a very short acting sedative that most ICUs use here. Okay, most ICUs they use the Dex here, and another name for it is Presidex. Okay, so instead of two, because the patient was very agitated, the nurse started from five just to calm the patient down before um, the dose could be tapered down. I don't know what happened, but this is not an outsider who reported the nurse. The directors themselves, they reported the nurse to the board of nursing. Sometimes you don't know what will happen. But, when you hear of some of these things, you get scary. Okay, but please do what over here. It's like even the urethral catheters, you have to be given order. Anything you should be given an order to do it. Okay, so just look at your order. If you don't have any order, request for an order. Then do it. You go your way. So everything you follow orders and you do it exactly as it is. Antibiotics over here, don't joke with it. Okay, so um to add to what our sister was asking, please, um, what was the initial question, before I even use all these things as an example? Yes, so you were like, you hold the medication. Yes, I remember. Please, don't hold the medication. Okay, if it's meant to do something, you don't want to get seizures. Remember yesterday I said seizures is something that no doctor wants because of its effect on the brain. Okay. The person is not um lethargic. Okay, and even when it comes to lethargy, please, when patient is lethargic, you can even give phenytoin because phenytoin doesn't have that sedative, I mean that maximum sedative effect like how phenobarb and benzodiazepines will do. Do you agree with me? So in real life case situations, you can even give phenytoin even when the patient is lethargic, okay, to help prevent seizures. But thinking of phenobarb and benzodiazepines, please, barbiturate and benzodiazepines, please, when they are already um, drowsy or they are down, don't give it. They'll send, I mean, they'll take the patient further down, okay? This one, the patient is going for a procedure. If you don't give it and something happens, then they will track what anti-seizure medications is the person taking. Then they will come and look at the medication. When was the last time he or she took the last dose? And if they track and they see that a dose was missing, is you are in trouble. Okay. MPO, fine, the patient is MPO, but look at what the drug is meant for. So you also have to assess that one, not just the mere MPO. Okay. That is why you have to be part of the holistic care of the patient. You see, like what we are saying, understand why you are giving the medications and what it's going to do for the person. So definitely the person will need a dose of the phenytoin. So ask for a different food to give other than skipping. If let's say the person's let me use the metoprolol example that you referred to give an example here. Let's say if the procedure will involve let's say giving how do we call it? Giving medications for anesthesia, okay, anesthesia medications. And blood pressures are around 150, sorry, let's say 140, 150. It depends. Sometimes if you are aware that the procedure, you can't be sure though, but if you are aware that maybe the procedure is likely to bring, okay, let me give you a common one. Let's say if the person is going for dialysis, okay, and blood pressures are around 150. Even when blood pressure is around 160, it doesn't, and a patient is scheduled for maybe any antihypertensive, it doesn't make sense to give the antihypertensive before the patient goes for dialysis. I hope you understand. The blood pressure is high though, okay? The blood pressure is high, 160, maybe 100. The patient is going for dialysis and the patient is already on scheduled antihypertensives. Please, it doesn't make sense to give your antihypertensive. Don't give it. Let the patient go for dialysis, and the dialysis itself will take care of the blood pressure. Okay, when they remove fluids and all of that, blood pressures will come down. So when you give your antihypertensives and the patient goes to the dialysis, or patient goes for dialysis, patient is likely to be very, very hypertensive to the extent that we've seen cases before. Sometimes they can even go down if care is not taken, they can even arrest if they are not on cardiac monitor for you to catch it early. Okay, so every situation is different. Okay, know the drug, what is going to do for the patient and the circumstance, then you can do your calculations. If you are not sure, you can always ask. Okay, we all ask questions. So if you are not sure, you can always ask. Please, do you understand? The one who has the question, do you understand all
Ye-
these illustrations have made?
Yes, please. Thank you so much.
Oh, you are welcome. All right. I think we have maybe a last question or maybe last but one. Is a reader here?
A female client who takes medications for seizures has been placed on warfarin for thrombophlebitis. After the weekly prothrombin time, the client mentions that she's out of her barbiturate sleeping pill and needs a refill. What is the most important reason that the nurse should instruct the client to obtain the refill immediately? 1. The client is at risk of developing withdrawal syndrome. 2. The absence of sleep could precipitate seizures. 3. Discontinuation of the drug can affect the prothrombin level. 4. Seizure control depends on the combined action of the medications.
Mm-hmm. Who wants to try? This is a very tricky question.
Yeah, it is.
I intentionally got this one. I saw it somewhere. Who can
The
try?
client is at risk of developing withdrawal syndrome. Sentence is between 1 and 2. 1. I'll go for 1. The client is at risk of developing. Yes. Say please 1.
So, do you know something about NCLES? The correct answer will look very awkward sometimes. To the extent that when I even give you 3 options, you still not choose the correct answer.
I was thinking of. Yeah, I'm considering 2.
Okay. So that is your second chance, and you are still wrong. You see the thing?
Yeah. 4.
Someone said 4, and you are still wrong.
Yeah, I see 1. I said 1, sorry.
3.
Yes, I
Someone
said
said D.
Sometimes they trust
Because
your
you said,
instincts.
oh, it's affected.
So this is an additional knowledge. Okay?
Yes, yeah.
This is an additional
Most of
knowledge.
them are
Let us pay attention to this part and keep it. Okay. So you have a female client who takes medications for seizures. Okay. He's been placed on warfarin. So the person is taking warfarin for thrombophlebitis. After the weekly prothrombin time, they normally go for this kind of test, right? PT. So the client mentions that she's out of her barbiturate sleeping pill and needs a refill. So that is a way of telling you that she's also taking what? Barbiturate. And we are asking what is the most important reason that the nurse should instruct the client to obtain the refill immediately. So it's like after learning that, I'm trying to reframe the question for you to understand. Okay, so after learning that the patient who is taking warfarin is complaining of barbiturate that she is taking and it's finished, it is finished, you should be in a rush, okay, to replace it for the patient. Other than that, or otherwise, something is likely to happen. Okay, and we are saying that yes, bleeding is likely to happen if you don't replace the barbiturate. Okay, and this is the reason. So note that warfarin and barbiturate, it's like barbiturate reduces the efficacy of warfarin. Okay, look at this one. Or let me put it this way: it breaks it down more instead of reduce. Like, in the one way or the other, it's reducing the efficacy. So barbiturate increases the metabolism of what? Warfarin. Okay, it helps to break down warfarin all the more. So if the barbiturate that the patient is taking is breaking down most of the warfarin, and now the barbiturate is finished, and you have the person taking the same dosage of the warfarin, what do you think is likely to happen? You have everything, every dose of the warfarin the patient is taking in the system, okay, and more bleeding is likely to occur. So you are saying barbiturates increase the metabolism of warfarin, thus reducing its anticoagulant effects. Okay, it reduces, so it's like I said, it reduces the efficacy of warfarin. So if barbiturate is stopped, and over here you can't say because of that the patient should not take the barbiturate. Okay, I mean they are all serving a purpose though. Okay, they are all serving an important purpose. This one will not prevent this one from working at all, but it is just that it will make it a bit less ineffective. Okay, like it will reduce the efficacy a bit. So if the barbiturate is stopped, the effect is lost. Okay, leading to increased warfarin activity and a risk for bleeding or a risk of bleeding. So that is why you will have to replace it quickly. So this is just a new thing that maybe we can put down somewhere. Okay. All right. Any question on this one? We have our last question, then we can carry on. Our last question. I told you we have a lot of questions on this
So please, I have a
one.
question.
Okay, can we take our
So,
last question?
oh, I said I have a question.
Okay.
Please, my question was between seizures and risks of bleeding, which one is very important, or which one will you prioritize first? Seizures and risks of bleeding.
Okay.
Mhm.
So if you want to if
Mhm.
if if you get prioritization question, my mouth is dry, sorry. If you get prioritization question and you want to get it easy, sometimes with these things, ask yourself which one will kill you first. As this time was the question, which one will kill you first?
Uh, Seizures.
Okay, are you sure when you're having an active
Bleeding,
bleed? It
bleeding,
depends on the kind
bleeding
of
will kill you first.
if you're having active bleed and
Oh,
you're
I
having
didn't get your
seizures, which one will
question
kill
well.
you first?
I didn't get your
Oh,
question well.
okay. Yeah, so sometimes you can ask yourself these funny questions to answer prioritization questions. It works a lot. Okay. When you get
Okay.
too tight situations and you think all of them are devastating, ask yourself maybe which one would die first? Okay. Something like that. Which one of them is likely to die first? And if you're able to figure out, it's likely to be your answer. Are you there?
Okay. Yes, please.
Mm.
Thank
Hello, sir.
Have I answered
Hello,
you?
sir.
Or there's another hand? Okay.
Sir, please, I want to add up to your question. So she said
Okay.
bleeding and risk of seizure. So we have actual and potential causes. So you have to go for the actual, which is bleeding, and leave the potential because you said risk of seizure. So you have to think about that one.
Okay. Good. Good.
All right. Thank you very much.
People's prioritizations are working. All right. Okay. So that is it. Okay. Let's take our last question. So this
The
one too, you will see. Okay. Let me keep quiet until you're done. Uh-huh.
The client
Oh, who's
receiving
reading?
the client receiving phenytoin asks the nurse why the healthcare provider has prescribed folic acid with this medication. The nurse's response would be based on which item of information. 1. Phenytoin improves absorption of iron from foods. Folic acid content in common foods is inadequate. 3. Folic acid prevents the neuropathy caused by phenytoin. 4. Phenytoin inhibits the absorption of folic acid from foods.
Okay, and what do you think is the answer?
It's the absorption of folic acid from food.
C.
Folic acid content in common foods is inadequate.
Hey.
C.
Three.
Everybody's
Uh,
mentioning
uh,
something there. Everybody's saying something there. So
four,
this question is
four,
very tricky, eh?
I said 4.
Yeah, so the
four.
answer is 4. Okay,
Yeah, it's 4.
the answer is 4. So let us, this is also a new information we can add up. Okay, so phenytoin inhibits the absorption of folic acids from foods. Okay, so let us take note of this too. This is our rationale. All right, now let's talk
Go back.
about the next thing.
Thank you.
Now let's talk about the next thing. CNS stimulants. Okay, remember we've done uppers and downers. Remember, those of you who joined not long ago, yesterday I posted the previous videos. Okay, there are two. If you watch them, I think you're gonna catch up. Okay, try and watch them, and they're also on your dashboard. So when you get to pharmacology, you see them. Okay. So we talked about uppers and downers, right? And we said uppers examples are stimulants. Okay, or uppers are like stimulants. Okay, uppers are stimulants. We looked at some of them like cocaine and the rest, amphetamine. Right. We are going to look at the drug aspect. So amphetamine, we mentioned that, and we mentioned some other stimulants. So we are saying they are uppers. Uppers, when you hear uppers, what comes into your mind? Like all vital signs go up, right? All vital signs go up. Yeah. So you have blood pressure going up, heart rate going up, respiratory rate going up. All of them will go up. All right.
Wait. I'm in class.
All right. So we are saying they stimulate the
I'm
central
gonna give you
nervous
juice.
system,
Come.
and the main classes we have are anorexians. Okay, which promote weight loss. We have amphetamines, which increase norepinephrine and dopamine, and we have drugs for narcolepsy and
Influence
attention
drink.
deficit hyperactive disorder. Okay,
Oh,
and what we are saying is that for them, they improve wakefulness and focus. Okay, they help you to focus. So when you hear of stimulants, okay, please, stimulants, no matter the class or whichever, these are what they do. Okay, all stimulants, these are what they do. So they are used for treating narcolepsy. Who knows narcolepsy?
They are
Hey,
always feeling sick.
sleepy within the day, okay? Within the day, then they'll be feeling sleepy throughout. So narcolepsy, we use stimulants for treating people who have narcolepsy. And we use it to treat people who have attention deficit hyperactive disorder. We use it to to treat people who have attention deficit disorder. So this one, they are similar. They are similar. Okay, just that in attention deficit disorder, there is no hyperactivity in it. Okay, so patients can be very calm over here. Okay, just that they have attention deficit. Okay, but for this one, we have attention deficit and they are also hyperactive. So that's the difference. Okay, and
Okay.
stimulants can also be used for short-term weight loss.
Mm.
Okay, when we
Mhm.
come the next